Okay, listen, this question has come up several times in the clinic about what is the best way to get a good night's sleep if you have lower back pain. And that question is the root of it. Like if you really can't sleep because you're having your back pain, what do you do? It's a real struggle, and it kind of sets up the whole day. The whole day becomes around you know the fact that you couldn't sleep because of the back pain. You're more lethargic. Your body can't recover. Your endurance is compromised, and everything kind of trickles in. And they've shown disrupted sleep can affect diabetic. As far as people with diabetes, they can get pre-diabetic, cardiovascular function. All these things can trip into a problem if you don't get a good night's sleep. So if you have back pain, we often give out exercises here that'll, common exercise for lower back pain or lumbar extensions, which I can show you real quick here if you can see in the camera. And they're basically, the reason why I'm going to show this, you'll understand in a second, is standing lumbar extension. And I'm even a little bit tight right now after sitting. Okay. And the standing lumbar extension, or if it's another exercise that your therapist or you've been given that seems to relieve your pain, I always suggest to people to try and do a little bit of that exercise just before you go to bed. Just try a little bit and see, just before you go to bed, as far as your routine before you settle down. I think the pain is one thing, but to set the best environment to go to sleep is equally as important as what to do when you go to sleep. Before you go to bed, another thing too is as much as endurance or training is important, like walking, bicycling, and that's a big component of back problems. Is people are poor endurance because they become less active and they have problems because of that. But some of the other things to consider too is not to do that 2 hours before you plan to go to bed. To consider maybe doing that in the early morning period as a wake up to kind of get moving again, which is a tough time for a lot of people with back problems, is that early kind of period of time as far as transitioning after lying down all night, which is kind of, as much as it's kind of one position, even for a while, and getting up from that, from non-weight bearing to weight bearing. And that can be especially hard with patients with disc problems. So the evening routine should be based upon setting the tone for best practices to get a good night's sleep. And hopefully, if you're more restful and you're in a deeper sleep, you're less chance of getting aggravated through the night because of your back pain. And hopefully you get a little bit greater quality of sleep. So reducing screens at night, using a regular book, reading from a regular book, really keeping everything outside of your bedroom, from TV to light, using some dark shades, just to really create a very warm, really great environment. Warm, let's just say warm meaning like physically warm, like inviting environment when you're ready to sleep. Not having caffeine, not having alcohol too close to bedtime or at all. Some people just, as soon as they cut out caffeine, they really start noticing that they start feeling, better. They're more restful. They're ready to cycle down. Even doing some little meditation. I've been looking at, I think it's called Headspace or Heads Up, an app. Let me see if I can find it right now. And they talk about, let's see here. Pretty sure it's Headspace, and I should have it. Yeah, Headspace. And they've got some really great, simple ones, non-judgmental ways of meditating and kind of getting to relax. And that really has been great for me as far as kind of cycling down and using that. There's other ones, I think iTimer or whatever, and they have one specifically for sleep, to kind of set the tone. So what else can we do to look at that? As far as the temperature in the room, really having more of a little cooler environment typically is better, not for everyone. We're just looking into possibly getting what they call a chili pad, which is a pad which you can set the temperature. It basically is over the top of your bed if you're sharing the bed with your spouse, whatever, and you can actually just get one section of the bed, and it'll set the temperature that's best for you as far as a restful sleep. Things like these strategies on trying to set up the night to be the best night, sleep is really important. Doing some gentle breathing exercises. One of the ones I talked about a little while ago is box breathing or square breathing is a great, simple technique to help you kind of reset and relax, especially everything going on right now in the world. Our minds are kind of going everywhere. and I think it's hard to kind of reset. And the box breathing or square breathing you'll see on my other videos, I did it a few weeks ago, was really, it's always helpful for me to go over, even just instruct someone on it. Like I feel better showing it. It actually tunes me into how, if I'm jammed up and I'm really type A and I'm really edgy, that allows me to realize I'm a little hyped up. I have to relax, and kind of sets my tone. So I really think it's something that can really be quite beneficial. But all these little things that we're talking about, between the box breathing or square breathing or some meditation tapes, there's some great apps out there. I say tapes, making myself old. Apps that have pre-recorded meditation, not exercising too close to bedtime, limiting that blue screen time that kind of charges our brain up. And I'm the person to say I'm not the best at this. I tend to like to read, and I have to separate that out. Maybe doing some of your activities, outside the bedroom. Like I said, dark shades. So all those things lead up to that. And then I would say, if you have an exercise, like an exercise that your therapist or doctor is giving you that seems to really settle your back pain, doing that closer on, but not a lot of it. You don't want to do enough, like we talked about, to increase your core temperature. And that's one of the ideas behind exercising before you go to bed, is you do it a couple hours before bed, getting that, really raising that core temperature you'll get from extensive exercise can really become more of a downside than an upside. So I really implore, I do think the cardiovascular endurance work, walking programs, biking is really great, but try and separate it so you get it in a little earlier. If you're really having a hard time, if you say, listen, I have to do it then you got to live with the consequences that it may be affecting your sleep, and maybe causing that back pain to creep in and keep you up. Most times lying on your back with like a pillow underneath your knees is a great way to lessen the amount of pressure on your back. Another one is, if you prefer to go sideline, lie on your side with a pillow between your knees and your arms is another way to we're just trying to limit the rotation. Also, like using a neck pillow to kind of be comfortable, all right, is better as far as positioning. Most times, most people do not tolerate well lying on their stomach. They're kind of a mess, and it's not great for the neck too. So those are some of the things to kind of limit as far as positions in the bed. But I will say that, most people move. I move a lot during the night, and whatever position I started in isn't the position I ended in. So keep in mind that those are some things that are good in theory, but I do believe if you can get a couple hours at the start of the night, and then maybe the rest of the night isn't as great a quality, why not get them? That's kind of my thought. So consider some of those things as little tips. It's more about setting up the night, to feeling better, and doing some very gentle exercises. If you've got, like I said, a specific one that someone's been giving you, like I said, we showed the lumbar extension is one of the ones you'll see that's commonly given out. Reducing that pain can be helpful. Now, hydration too, making sure you're well hydrated. There are things you can do if you're in desperate needs. I'm a physical therapist. I can't recommend medication, but taking a medication just prior to going to bed, where it's at the most effective dose, may be something that really helps you. Because when you're taking medications, and you got to talk to your doctor, your pharmacist about this. It's their area, they can prescribe it. But I always say, ask the question of your doctor. Hey, what's the most effective time? Can I take the meds for pain, anti-inflammatories or Tylenol? Can I take it just before I go to bed? Is that okay with the other meds I'm taking? If I'm not taking pain meds or anti-inflammatories, can I take that just before I go to bed? That may make for a more restful sleep, because typically these meds are at a higher potency, even if it's a medication that spans 6 to 8 hours. And you can check with your pharmacist about that. Typically, there's a period when you first take it that's a little higher impact, as far as you feel more of the dose. And if that helps you during that time, it's a strategy that some patients I know have been told by their doctors to try and implore. So just something to consider. It's just options. Everyone's got to find the option that's right for them, and what works for their body, their person. But I would say sometimes doing those exercises that are relaxing kind of helps out. If you haven't been diagnosed, you haven't been to a therapist, a simple, very, very short period of very gentle yoga exercise, not more than 5 or 10 minutes, just to kind of relax and set a tone, can be also helpful. as far as that that restful time is starting to go to bed. So anyway, listen, I just want to give you a couple ideas here before we wrap up for the day, and I hope they help you out in just feeling a little bit better. If you're energized because you haven't been having back pain, hopefully you'd set yourself up for a better day so you can actively exercise, you can do more proactive things the next day. So anyway, have a great day, and hope you got something from this. Have a great one. Bye-bye.